Dr. Allan Grill joins me now, Chief of Family Medicine at Markham-Stouffville Hospital. Dr. Grill, good to see you.
Good morning, Angie.
How are you feeling just listening now, sort of to what extent certain hospitals are having to make in order to deal with the patients that are coming in? What are you seeing? What are you hearing from patients right now?
Yeah, thanks so much for asking. So, our hospital in Markham is seeing a high volume of patients in the emergency department, particularly young children. And I think it's not unique to our hospital. We're hearing a lot about this from across the province. I'm in close contact with the chief of emergency medicine at my hospital. And, the cases of respiratory illness has almost doubled since the summer. I think they were seeing about 50 cases a day. It's now up to about 100, and that's on top of everything else that has to come into emergency room when people need care. So, we are in a crisis right now with regards to respiratory illness, and it's not just COVID-19, right? We're seeing influenza, we're seeing RSV, particularly in young children. We are seeing the common cold. And even in my office, we're seeing a lot of people coming in both during the day and in our after hours clinic with respiratory illness. And we're all feeling it in the system. So this is definitely something that is having a strain right now.
Having a strain and reigniting the conversation with regards to masking and masking in public places. We know that there's the conversation about bringing masking back into schools, into that school setting where with younger children, for example, that spread of, and whether we're talking about COVID or not, but just around the flu season, you see that spread among kids and more kids getting sick. What are your thoughts here? Should we be bringing masks back?
So I've always been in support of wearing masks during the pandemic, and especially now when we have a lot of viruses circulating in the community. We know that masks help. It's a great tool in our public health toolbox. They help protect you against the spread of viruses. They help protect others if you get sick from spreading it around. So I've always said it's important to wear masks, especially indoors where it's not a well-ventilated space and there are lots of crowds. The other thing we have to remember is that there are people in our community that are higher risk. So people with compromised immune systems, people with chronic medical illnesses, the elderly, we need to look out for them. So I am definitely a proponent of wearing masks. I would say though that if you're going to make masks effective, to only do it in schools, I'm not sure is the right decision, because those kids could then go out after school. They could get together in social settings. They could go to sporting events where thousands of people aren't masked. So if we're going to do this and we're going to come together as a community to support each other,
right,
everybody sort of has to wear masks in the appropriate settings. It can't just be in one spot, because I don't think it will be as effective.
Yeah, and of course, with the holiday season coming up as well, shopping, of course, will be ramping up. People will be having, we assume, holiday parties. What are you going to be keeping a close eye on now, doctors? You're saying you're already seeing the level of cases coming into hospitals and your office as well.
So I think key public health messaging is very important right now. I think that people have to realize that the healthcare system is under a lot of strain. So we have these viral illnesses that we mentioned floating around. We have a lot of patients in hospital waiting for long-term care, and they're taking up beds. We have a shortage of staff to take care of. So our system is under strain. That's why we have a lot of wait times. And we're starting to have conversations about delaying surgeries. We're seeing kids miss more school because they're off sick. I mean, these are all the things that as a community we need to be thinking about, and we need to support each other about. So I would say, with regards to getting together in the holidays, definitely think of masking, but also think of the other things that can prevent you from getting sick. Please go out and get your flu shot. You can get it through public health, your primary care provider. You can get it through your pharmacist. That will definitely add to your protection. Be up to date on your COVID-19 vaccines. Again, readily available across the province. And if you are sick, please stay home. Don't go out and spread it to other people. Seek care from your primary care provider if needed. And obviously, if it's an emergency situation, you have trouble breathing, kids that can't eat or drink because of respiratory distress, or they're lethargic and it's hard to rouse them, those need to be seen in the emergency department. But if we all come together and support our system and use the lessons and tools that have helped us so far, that I think is the direction we need to go in right now.